Hello, welcome to the first ever BFLLWS podcast. Today, we are going to talk about the importance of resistance training and the right nutrition and how exactly these two things can help you to have a better lifestyle. So, today we are having two special guests, Dr. Tanmoy Dash and our nutrition expert, Shashikant Iyengar. So, without wasting much time, let's start this conversation and let's figure out what are the answers you can get through this podcast.
Our podcast Health Talks, and I'm really happy to have Dr. Tanmoy Das and nutrition expert Shashikant Iyengar with us. So today we are going to talk about the importance of resistance training and all the strength training and the nutrition part, that how exactly these two things help to improve the overall lifestyle. But before starting this overall podcast, I'd like to listen and hear a bit of information and statement from both of these consultants.
Good afternoon, and I'm Dr. Tanmoy Das, and we are here to discuss resistance training today and how it is so important to your health. As you all know, our muscles are our strength, and they are the building blocks of our health. Muscles have a peculiar property: either you use it or you lose it. And as we grow older, it is muscles which will take us through, because the muscle health and the bone health are intimately related, as I have told you before. So to maintain the muscle health, the common idea is to go for jogging, running, walking, which is known as aerobics or endurance training. But that alone is not enough. In fact, long duration endurance running and cycling and jogging may be harmful as you grow older. The other alternative, the best thing to do is to train your muscles in a supervised manner. And that will give you not only the muscle strength, but the bone strength. And this in turn will prevent you from having long-term diseases. And that is just to begin with, Mr. Shashikant.
Yeah.
Right.
So as explained by Dr. Tanmoy, muscle is one of the very, very critical component of health. In fact, it's said that muscle is the organ of longevity and even vitality.
Yes.
So, and very often we have seen that, especially in countries like India, we are so malnourished that we face what is called as sarcopenia or loss of muscle
Right.
as we age. So,
Right.
so muscle building through resistance exercise is an important aspect. The other important aspect is nutrition, proper nutrition.
Right.
So the importance of nutrition really sets in, because we as a country, we are a protein deficient country. That means our average intake of proteins are only around or less than 30 grams per person. And this is including every protein, first class, second class protein, everything.
Right.
This poor protein component of our nutrition is leading to various diseases, and which is compounded by the fact that most of us are sedentary. And we think that resistant exercise or muscle building is only for bodybuilders,
Correct.
which is a very big
It's a very big, myth and misconception. Sorry to interrupt, Shashikant. But the fact is, this is really true. That whatever you just said, this thing is directly, people think like it's only for bodybuilders.
And muscles, if we build up muscles, it will help us control various diseases, including diabetes. It will help us resolve obesity also. So the more muscles we have, uh, uh, the muscles have the capacity to absorb more glucose. It will have additional insulin receptors. So blood sugar control improves also. So these are the various features. We can go on and on talking about the advantages of building more muscles. So we did not go and have tons of muscles, unlike these bodybuilders who go for competition. But basic resistance exercise to build up some basic muscles is needed, and I think Shomik can throw more light
Right.
on it.
Yeah, but before starting with the resistance training, I would like to ask a question to Dr. Das, that why especially women must start doing resistance training? Like, what do you think? What would be your opinion on this?
Um, the concept about women starts from right from childhood. Somehow, boys grow up doing a lot of exercise and activity, and society does not expect women to uh, do exercise and become masculine. There is some kind of myth surrounding or some kind of social stigma.
Hmm.
But it is in fact that you should grow up in a very active and healthy way. Your muscles should be well developed. There is something known, the concept known as a muscle bank, just like there is a concept of bone bank. So while growing up, only the muscles of the women are not very well developed. And then what happens once you enter into middle age and 30s and 40s, the because of lack of muscular exercise, the bones are also affected. So the very first thing that happens is osteoporosis. And the only way to prevent osteoporosis is to do resistance training. That is what women. Um, uh, Resistance training can help women in so many ways. Not only develop muscle, but improve the posture and prevent other diseases also, like diabetes, and in general, good health can be promoted. That's what I think.
Thank you. So now, like, people also don't understand, like, what are the factors that actually improve the condition or like can prevent from osteoarthritis if they start doing resistance training. So now, what would be your thought on that? Like, how exactly resistance training can help in prevention of osteoarthritis or early age onset of this arthritic situations?
Yeah, as I have told before, the muscle and bone are intimately related. In
Right.
fact, half the bone is not a piece of calcium structure which we see in anatomy classes, but it is a very dynamic thing. Half of the bone is muscle and protein. And as you exercise, as you do resistance training, what happens is it impacts the bone and pulls on
Right.
the bone, and that stimulates not only muscle growth but bone growth. And this is a mechanism by which uh, muscles grow up and the bone also becomes very stronger. So the best way to prevent osteoporosis is to do strength training, is to do resistance training.
Because
And
the armor, the shield, basically the muscles, and if we improve the quality of the lean muscle mass, that would protect the quality of bone, and that can help in the prevention of the situation of osteoarthritis. Right.
yes, a very good example is most common is developing early arthritis of the knee joint. And um, if you go to a doctor, they will invariably land up in doing a knee joint or being advised a knee joint replacement at least. But without looking at the muscle strength, a knee joint replacement should be only a last resort. Most of the time, a good development of the muscles which move the knee joint, we call them the quadriceps, and a few other group of muscles, can reverse early osteoarthritis. There are a lot of research to prove that. Sachin can vouch for the research.
Mm.
So
Right.
that's how it helps the women.
Okay. Cool. So, Shashina, now tell us, like, along with the resistance training, if a person starts like going into the exercise and properly doing physical exercise on all these things, properly following a resistance training path. So, what should be the nutrition program like? Like, how a person should know, like, okay, this is the way I must follow a diet. Like, what would be the part of the protein and carbs and fats?
Yeah. So Shomik, getting back to the earlier point also, like for women, yeah, it is very, very important because the woman, female, especially in our country, they take care of the family, however, they don't take care of themselves. So whether it is in terms of exercise, building up muscle, or even in terms of nutrition. So many of them actually stay malnourished. And many of the diseases, metabolic disease disorders are also not well looked after. So in addition to resistance exercise, what is important is we need a higher protein percentage in our diet, because Indian diet is again high carbohydrate centric, 70-80% may be carbohydrate, and whatever protein we take may also be mostly second class protein. As we say that in our country, my favorite quote is always that we are all grainitarians. We want to eat a lot of grains, and our protein percentage, protein content is very less. So it is very, very important that what will complement resistance exercise is proper nutrition in form of higher protein percentage is what we should take, and especially class 1 protein.
So how do you define these grades in the class 1, class 2, class 3? Because when I generally assess the nutrition part, or like when we handle clients and patients, that time this thing actually arises, this particular point. Like when we say this is a grade 2 protein, this is a class 3, class 2 protein or something like that, they don't understand. Because in India or like everywhere, like, people are so much aware of the protein, they think like dal means like lentils, or like other group of sales and vegetables, they also contain protein. So they think like they're getting sufficient amount of protein, from those kind of food. So how do you define like what is the class 1 and what is the class 2 protein? How do you explain that?
Yeah. So Shobhik, ऐसा है कि class 1 protein is something which contains those 9 essential amino acids together in the right quantity, so that it will go and build up our muscle, or it is involved in muscle protein synthesis. Whereas class 2 will actually lack some or the other protein. For example, rice would be a good source of lysine, which may be missing in lentil.
Okay.
And in lentil, which is a good source of methionine, while it might not have the required quantity of lysine. So that's what happens. So they mix dal and rice to get this complete protein. But in that bargain, what is happening is we are sourcing excess carbohydrate, and whatever protein percentage we get is very less. So the right kind of protein is what we get from animal sources, wheat, fish, eggs. और वेजिटेरियन के लिए एनिमल सोर्स मतलब क्या है? वो हमारा दूध से आ जाता है, दूध है, पनीर है, दही है, चीज है, इसमें से आ जाता है. और एक भी इन प्लांट वर्ल्ड में और एक भी कंप्लीट सोर्स ऑफ अमाइनो एसिड है, एंड दैट इज सोयाबीन से आता है. लेकिन इसमें प्रॉब्लम क्या है कि देयर आर लॉट ऑफ एंटी न्यूट्रिएंट्स, काफी एंटी न्यूट्रिएंट्स होता है जो प्रॉपर एब्जॉर्प्शन इनहिबिट करता है. वो काफी अदर इश्यूज होता है. सो हमारे लिए अगर क्लास 1 प्रोटीन है, देन इट इज मीट, फिश, एग्स, एंड देन मिल्क प्रोडक्ट, मिल्क, पनीर, dahi, cheese. So these are the class 1 protein which we should be able to include in our diet in adequate quantity. And as per how we'll decide from individual to individual based on their height and weight, we also determine. So it is highly individual. And in some vegetarians है, और especially जो gym में आता है, their requirement of protein is higher. So we can add whey protein. Whey isolate can be added in all these people.
Now, the moment you say gym, जो लोग gym में आते हैं, people think like this whey protein or and other this high protein diet, particularly for the bodybuilders. Okay, the thing that we said before when we were starting this podcast. So, like, if it would be better, like, if you two can share a particular message on this particular fact that this high protein, first of all, does not mean like this is only for the bodybuilders or people who are into this bodybuilding world. Like, there is a thing called physical exercise, which we are talking about, resistance training or strength training, and which is really, really essential for all the people or for all the age groups, especially for the 30 plus people. So, for them, high protein diet is really, really essential. If you can share a message, if you too can share, that would be great for all the viewers.
I think Dr. Saf can go first.
Yeah. Okay. Now, as we started the discussion with the message that protein is perhaps or the muscles are your longevity equipment. So unless you maintain your muscles, you are not going to remain healthy for a long period of time. And the only way to do that is to prevent long-term um, osteoporosis or long-term bone health is to exercise your muscles. And that can be done with strength training, as we told you. And for that, a high protein diet is essential. Unfortunately, in our country, we are 80% of Indians are protein deficient. They eat a protein deficient diet, and our even our perception of what is protein in a diet and what is not protein in a diet is also not perfect. So we need to be aware of what are the sources of protein even in a vegetarian diet, and to increase that protein percentage, and increasing that protein percentage and combining it with resistance training, it what is going to keep your muscles healthy. So that is what the program or any set of exercise or program which is supervised, like Mr. Sumik does, is what is the best possible science today is suggesting.
Mhm. Right. And Dr. Dash, tell us something about this diabetes and other metabolic disease. How these things can be handled properly? Like if somebody starts following a right diet, like a proper diet, a balanced diet in terms of like not just like the proper diet means not only a low carb diet, not only a high protein diet. There should be the proper macro and micronutrients completely incorporated. And so I looked at how these things can be managed properly if somebody starts doing resistance training and exercise. How exactly resistance training helps in prevention of, or like in the revision of the process of diabetes?
Well, when you train your muscles, that is a contribution to insulin sensitivity. But let me explain that to you. It sounds a bit technical. The most important and the best way approach to handle pre-diabetes and diabetes is to correct your nutrition first. Because type 2 diabetes means that in some way or the other, you are not tolerating the carbohydrate part of the diet which you are taking. So that needs to be addressed, because as Sashi will tell you, most of the international guidelines of treatment of diabetes now incorporates this fact. So it is very much official that type 2 diabetes can be addressed with correct nutrition of low carbohydrates. Once that is addressed, one of the ways which it can be enhanced is to get your muscles strong, because muscles occupy a large part of your body. And if the muscles are strong enough, muscles are bulky enough, it can take in a lot of glucose, and insulin sensitivity increases, and that helps to control the blood glucose. So diet and then exercise. Exercise means not running and jogging, cycling, but building up the muscles that acts as a sponge to take in a lot of sugar and glycogen. So that is how both combine together to control and address type 2 diabetes.
Thank you so much. Shashida, tell us, like, what are the primary symptoms that people get but they ignore when they are having the situation of diabetes, or it would be better if you say pre-diabetes?
Actually, the classical symptoms are जैसे इंग्लिश में पॉलीफेजिया, पॉलीडिप्सिया, पॉलीयूरिया, that is excess hunger, excess thirst, excess urination. These are the classical symptoms जो सबको पढ़ाया गया है. But काफी time, many a time, this will not be seen also. There are other symptoms which can be seen or signs which can be seen. For example, skin tags, and possibly maybe loss of energy and loss of muscle, especially अगर excess diabetes है, excess blood sugar है, then we are in a catabolic state. That means हमारा शरीर से muscle breakdown हो जाता है. ऐसा there could be lot of other symptoms. Frequent fungal infection है, ये किसी को समझता नहीं. वो सबसे बड़ा जो एक लोगों को समझता नहीं वो कि people can have frozen shoulder. Frozen shoulder is a sign of blood sugar dysregulation.
I didn't know this. Please explain on this. Like a lot of people complain about it, like frozen shoulder.
If people have frozen shoulder, then most likely, I will say, in fact, I will ask Dr. Tanmay for this. I will say it is 100% due to dysregulated blood sugar.
Okay.
I was suffering from frozen
It's a
shoulder.
very big information that you two are sharing on both, and especially this frozen shoulder. A lot of people are suffering with it. A lot of people, but they are not aware of it. Like this situation that the thing that you just said. Please explain. Like,
I was suffering from frozen shoulder for 1 year prior to diagnosis of diabetes.
okay.
So after diagnosis, I also got the same time I was diagnosed with osteoarthritis. So when I went to my orthopedic surgeon, he told me, had you come to me earlier with frozen shoulder, I would have told you to go and check your blood sugar.
Okay.
So the most frequent cause is frozen shoulder, and Dr. Das can explain more on this. There could be some sort of fibrosis which happens due to dysregulated blood sugar, and if people
Okay.
don't address this as early as possible, then fibrosis can develop and really make recovery very difficult. However, if they control blood sugar and then get some physiotherapy or possibly come to a gym where they can be counseled properly, they can actually get rid of it. So not only frozen shoulder, osteoarthritis. So metabolic disease is also involved in osteoarthritis. So other than strengthening those leg muscle to prevent osteoarthritis, what can happen in the background is if people are running high blood sugar, then that will impair the nutrients reaching those cartilages, and
Yeah.
it can actually damage. There will be a lot of oxidative stress. There are a lot of oxidative stress. So that's how it can happen. So osteoarthritis is also said to be part of metabolic disorder. So if people come with osteoarthritis, they come with frozen shoulder, just go and check the blood sugar. It has to be dysregulated.
All are
Actually, yeah. What needs to be remembered is type 2 diabetes or hyperglycemia for a long time is due to insulin resistance. That means your pancreas is being stimulated for an abnormal period of time continuously, and has given rise to high insulin levels, hyperinsulinemia we call it. Now, this hyperinsulinemia, chronic hyperinsulinemia, is an inflammatory state of the body. Like the entire body is kind of irritated. So, in this irritation, this hyperinsulinemia manifests in many symptoms. If the shoulder gets inflamed, the knee joints get inflamed, and it can go and cause clotting in various areas of the body. So starting from shoulder to knee joint to forming gallbladder stones to polycystic ovarian syndrome, which is very common in women, all are due to one reason, and that is hyperinsulinemia. And there is no medicine as such for it. That has to be addressed by a diet and a high protein diet, or rather, an adequate protein diet is a very much a part of maintaining a normal.
adequate protein intake, simultaneously resistance training to build up new muscle mass, to prevent the degeneration, and to support the regeneration process of the new muscle mass, to have better muscle protein synthesis that would help to grow more muscle, and that will help in the overall process of glucose tolerance. So that is how resistance training and nutrition, both of these two things, if somebody can balance these two things, that would be better for to have a better lifestyle.
So, Shomik, regarding this high protein diet, again, with the fear we have.
Yeah.
Okay. So, the studies have shown that up to 3.5 gram per kg body weight is safe, which has been tried out. Now, for an average weight of 60 kg, 3.5 grams per kg body weight means crossing 200 grams of protein per day, which many people do not do. We are at 30. For us, even reaching 0.8 gram per kg body weight, it seems to be like high protein. 0.8 gram is the basic fundamental which is required to prevent degeneration or at least maintain the muscle mass. Maintain. I'm not talking about growing and thriving.
Growing just to maintain
Yes.
whatever.
And
he
we
or
are
she
not
has.
even we are not even on 0.8 gram per kg body weight, which is recommended. And remember, this 0.8 gram is first class protein, not all protein put together.
Got it.
Whereas we are not even reaching the 30 gram with whatever protein it is, plant protein, animal protein, first class, second class, whatever it is. So there is a very big myth in India that protein damages kidney.
Right.
Protein will damage
When eating the uric acid,
everything. Uric acid, everything.
yeah, it
Everything.
also inhibits the process of better digestion. People also talk about like a lot of people have this concept like it's better to avoid protein during night during dinner because it slows down the process of digestion and something like that. People think like this.
And this is so funny that people say that protein is difficult to digest, and they will keep having simple carbohydrate, which is easy to digest, and they will feel hungry again. They don't know the biggest advantage lies in protein. If you are on a higher protein diet, it will lead to less frequent hunger, and then
Yes.
will eat less frequently and improve our health. So
Yeah.
what they quote as a disadvantage is actually an advantage which we don't realize.
Correct. True. That's the point. Like, this is why we should spread the awareness as much as possible because people are not so familiar with these things because somehow because of lot of misinformation, lot of mixed articles on Google search engine. People nowadays like they just search it on Google and they just try to find out the solutions by themselves. And in the end, what happens for normal people? Understanding how exactly a search engine works. And if you type something, you would be getting, articles like that on it. So it becomes very difficult for a normal person, for a layman to understand what exactly right and what's not right. So how do you handle, it's like Dr. Das, how do you handle like patients sometimes when they don't actually understand the importance of the high protein diet, when they say like, no, something like that, how do you manage people like that sometimes, like just share glimpse of that?
Yes, actually, you have to look at the problem from the patient point of view. It is unfortunately a fact that we are not only a protein deficient nation, we are also a protein unaware nation. There is a lot of studies have survey rather has shown that many people think something is a protein. For example, one survey called Prodigy survey showed that even lactating mothers and young women, the family makers, the housewives, what they thought and cooked as protein in the house is not actually protein. People believe that green leafy vegetables contain a lot of protein, but that is
Right.
not. So this we say zero point 0.8 grams per kg, Sashi, and 1 gram per kg, but it doesn't translate to them. What is this 0.8 and what is this protein? And so we have to really get to the basics and explain that per kg body weight, you need this much protein, and that one egg will contain 6 grams or 7 grams. So accordingly, you can calculate. So it takes a lot of explaining, a lot of motivation. Done. It unfortunately cannot be done in a busy OPD medicine based practice. That is just not possible. So this kind of practice takes a lot of explanation and maybe motivation, and then writing down and then committing them to it. So and when they themselves see the benefit after some time, that is what keeps them going. So basically, seeing the point from patient point of view, explaining to them, writing it down for them, that would help. I think. Along with
Right.
the exercise.
Understood. So Shashida, how do you manage people who are having the concept of like, no, I don't eat animal-based protein or something like that. So how do you handle those clients, like to manage their overall nutrition part, because it becomes very tedious and also important, and also becomes like most importantly, the moment we get to hear, no, I won't eat animal based protein or something like that. So how do you handle those situations?
I think, Shomik, these are all very personal thing in the sense that people are religious and they may not go. So I work with lot of vegetarian clients. So for me, I leverage the milk proteins. Use lot of paneer, curds, cheese, and in selected cases, even if they don't go to gym, I recommend whey protein,
Okay.
because if the protein is intake is very less, or they are not able to take as much adequately. Otherwise, those who take animal protein, then it is very easy for them. And then quite a number of vegetarians also take eggs. So eggs is the nature's multivitamin, as we say, contains everything except vitamin C. All vitamin contains. So we include a lot of.
Okay, there is a peculiar social factors are involved. I'll tell you this. Um, uh, what happened that I advised a lady to at least start taking eggs, and now she said that I cannot take because my husband doesn't like it or take eggs. So the social men will keep aside the protein for the men in the family, or themselves not take if the husband is not taking. So these social nuances are also there. That you must have experienced.
Yeah.
Right.
So what has happened?
It becomes difficult actually, like when people mixed up this religious things with science, and like you like when you handle in a very scientific way, and it becomes difficult like when they try to bring this spiritual or the religious things, like I cannot have this on that day, or like I don't eat this because of some issues, like uh, I don't like the taste of fish or smell of this or that. So these things becomes, uh, I think, very challenging, right?
Yeah, you need to work around it. I usually tell them that consider these as medicine. At least consider one egg a day as medicine, because whether you like it or not, your body needs it.
Right.
Rest is our belief. Belief is one thing, and health is another thing. So we have to make stretch both of them somewhere and come to a point where even if you believe that your belief is coming in the way, your
Right.
body kind of demanding it. So
Right.
sometimes it helps.
So in our country,
Correct.
we have a lot of different days: Tuesdays, Thursdays, Saturdays. So they will not have. Ultimately, if you really see, people will have non-vegetarian stuff only on one day, that is Sunday. And every day they are having high grain consumption and practically nil protein. So that's how it is. So slowly we'll have to work on them and see whatever is the acceptable level of protein they take. Okay, if it is a religious day, they can take veg proteins, which are in the
Right.
those days,
Right.
paneer, cheese, eggs, or even whey protein are included. The rest of the days, they can go ahead and take animal protein. But then, yes, it is a real challenge in India, and especially with all the pushbacks from various, agencies or the Western interests. So they will keep speaking very bad about all the animal protein, because they have something else to sell, which we don't realize.
Medications.
Not only medications, because they have an alternate source of protein to sell. Plant protein made in plants to sell.
Yeah.
So a lot of such propaganda is there, for which we need to see through. There are billionaires who fly in their own private jets, and then they will come in with a lot of propaganda, and they will say that this protein is good, because they want to make money. They are
More money.
finding an alternate market, or there's an existing market, and they're bringing an alternate product in that. So that's how it happened. We need to see through.
Right. So coming back to the point, yeah.
Another example. Sometimes I when nothing convinces them, I take a drastic step, and I ask them, how desperate are you? Exactly how desperate are you to improve your health? If you are desperate, you realize the harmful effects of the drug, then just go out of the room and come back again with a fresh mind. that you will not be influenced by whatever you have learned in your life so far. And trust me to improve that. Trust me to tell you the right thing and to eat what is really needed for your body. So that is how I try to motivate. It's
So lastly,
sometimes it
coming
goes,
back to the point, yeah, please, yeah.
yeah, go ahead.
No, you finish, please.
Yeah, so that motivation I think is very important, and how much the person really wants to improve the health is also matters a lot, because you try to convince somebody who's not ready to be convinced, because this is a two-way thing. It's not just you take a pill and they will become well. So it's a two-way thing. They tend to give up. They will try taking a high protein or a low carbohydrate for some time. They feel hungry and then they say, no, it doesn't work. And somebody else should tell them something, no, this is a dangerous thing. Who told you to do this? So these things keep on happening and they have to stay motivated throughout this misinformation, as Sashi mentioned. So that is what takes, I believe, constant supervision and a constant mentoring and the kind of packages I think Shomik has devised, and that person stays motivated throughout. And sometimes what I do, I if I have a conversation with a client or a patient, I sum it up and write it down and send it to him. This is what we discussed. This is what you have planned to do, and this is what you have promised to do. So that kind of keeps them motivated. It's called call summary. Maybe you can think of
Right. So coming back to the point, lastly, on the resistance training part, as you said, like how difficult it becomes sometimes. People who are having this facts in the mind, like religious facts or like social factors, environmental factors, all these things. The same thing actually happens when it comes to the exercise part also. Like uh, because of the gyms, the commercial gyms, people go there, but somehow because of that cliche training protocols and the programs, like the way it's get implemented on the client, they feel scared of going to the gym. Like, no, I don't want to be that much exhausted once I come back. Once I finish my session, I'm having soreness. I'm not having the strength to get up, the next day after going to the gym. So all these things happen during resistance, in the fact when it comes to resistance training as well. That is why also people avoid going to do exercises. They tend to go for yoga or any other stretching based exercises. So, like the importance of strength training or the resistance training, how exactly it helps to improve the muscle mass. These things, this message must be shared, must be completely into the minds of all the people. Like, because people are so much unaware of this. They don't know that how exactly resistance training can help, or like there is nothing like that. Like if I start doing exercise, or if I go to a place to follow resistance training or to follow a program of physical exercise, I won't be exhausted that much. Because actually, in reality, if somebody is doing resistance training or following a proper program of strength training, that person shouldn't be exhausted until unless something is wrong happening with that person. So what's your thought on this? Like, how do you share a message on this, Dr. Dash and Suchita? You too. Like, how do you share this opinion that exactly resistance training is safe, and you must start, like, people must follow a right program of nutrition and side by side resistance training. There is no need to fear of resistance training. That there is nothing like that. You'd be exhausted and you won't be able to get up the next morning. Like, how do you share that message?
And I would say that exercise done in the right manner will only rejuvenate you. It will only make you more energetic and powerful. And that has to be done under supervision. And we offer a proper supervised way of exercising. It is much less dangerous than going cycling, swimming, running, but because then you might fall down and injure yourself. Here, under proper supervision, if resistance training is done, it the muscle soreness will be very minimal or may not be there also. And as you build up the muscles, you will become stronger, and this thing will never happen.
True. So Sachita, what we have seen, like you have started going running.
So,
So how do you explain that? Like what are the importance of going for natural cardiovascular exercise rather than running on the treadmill? Or what do you how do you do it?
see, Shomik, to all my cases also, I recommend that if possible, they should go for resistance exercise. So whenever people have, a lot of body weight or lot of uncontrolled diabetes, I don't recommend any exercise except mild walking till that comes under control. And once that comes under control, I encourage resistance exercise because practically every study has shown that the best way to build up your health is to go for resistance exercise coupled with a good nutrition. And the other best way is to spare time, go to a gym and get a good individual coach who can actually guide you. So, okay, there may be, see, whenever we start any new regime, there is going to be a bit of aches and pain. If you start running, if you start walking, there is always going to be a bit, but these are all transient. So ultimately, we'll reach a level where we will not have all these aches, pain, we will not be exhausted. So I think what you require is a good trainer, a good
Flow of exercise. Yeah.
who will actually do that. And probably that's what you are offering now in this new venture which you have. A very scientific based approach and gradual progression of the resistance exercise. And I think there's nothing better than resistance exercise in terms of whatever activity you do.
Actually, people have a phobia about resistance training, but that's
Yeah.
be very simple. Just like pushing yourself against the wall, sitting and getting up, and just doing some wrist exercises.
Right.
Yeah,
Is
so
it?
those
Right. Yeah.
simple things can be is known as the resistance training. And taking that further, it has been shown that when you use multiple joints, instead one joint is one, and multiple joints are even more beneficial. So resistance training is the entire science of preventive health is pointing towards that.
True. Compound based exercise. That is what you said. Like compound
Yeah.
exercise rather than
Compound.
joint movements. Yeah, compound movements. True. So I think like people have got enough answers and the right messages through this podcast, and we hope to see each other over this conversation again and again, like the way we
Yep.
used to. But it's like totally different on Dr. Das, your schedule, Shashida, your schedule. Like it's very important. And simultaneously, we would love to have further more podcasts, further more conversation like this to share the right message to all the people out there, because we must share the information and also the awareness on the right nutrition, like how exactly a right nutrition can change life, and simultaneously how resistance training can improve the overall quality of life. These two things, and we must keep on doing all these things like to improve the lifestyle of people, isn't it?
Yes, absolutely. Absolutely. That is the whole idea. Correct.
Right. So thank you so much, Dr. Dash, Dr. Tanmoy Dash, and Mr. Shashikant Iyengar, our nutrition expert, for joining this conversation. And I believe that people would love this overall conversation, and they must share all these, information that what we have shared through this video. And if you people have any comments, you can directly post on the comment section. I also can share this video if you really like this video. And I hope to see you too in our upcoming podcast.
Thank you so much for watching this entire podcast, and I believe you all have loved this entire conversation. If you really have any questions or any comments, please don't forget to post them in the comment section box, and like this video and share this video to help us to grow. And most importantly, we'll be coming with more upcoming podcasts, and we'll be covering more important topics like this. So keep showing your support and keep sharing our videos and liking our videos. Thank you so much for watching this video once again. This is Shomik. Time to sign off. Take care of yourself, love yourself, and experience holistic therapy with Big Fat Logic lifestyle. Bye.